back up and down. You pull the pinner back and up for an adult. Because she's an adult, that's what I'm going to do. So we pull it up and then pull it down. So I'm going to be holding this here. I'm going to use this hand. I'm going to pull your ear up and then down. So I will be looking into your ear. Oh, this is good. It's clean and there is no obstruction. So I'm going to be doing the same on this side. I am, sorry, over her hair. So I'm going to be pulling up and down. So, and I'm going to be holding it in such a way I'm conscious that anyone that bumps into me, it's not going to push into the patient's eardrum. The safety is very important. So I'm going to change this up because I will need it when I do the nose. So change this and put the daily one up here. So that completes my ear examination. So the next portion of my examination now is going to be her nose. So her nose, I am going to be looking for, inspecting it for symmetry. I'm inspecting for any redness, any discharge, which I don't see any. So the nose is clean and nice. So I am going to take my my ophthalmoscope, and I'm going to use another clean one for her. That's the container. So I'm taking a new clean one out of the container, and I'm going to be putting it in because this one is going to her nose, the other one went to her ear. So it's not good to use the same one for the ear and the nose. So I have it on. So what I am going to be doing is that I'm going to be looking at your nose, and I will ask you to please tilt your head for me a little bit. So I'm going to take this and I'm looking in. I'm looking for any spectrum deviation, which everything is clear and good, nice and good, pinkish. There is no anything. So I'm looking for spectrum deviation, and the mucosa is usually pinkish. So that is my test for the nose. So the next test I am going to be going is her mouth. So I'm going to go to her mouth, and first of all, I'm going to inspect her mouth for any crack, any redness, any dryness on the lips, which I am looking at it. There is no crack, there is no redness, there is no this kind of discharge, there is no, it is symmetrical, there is no any asymmetry, there is no dryness on the lips. And then I am going to look into the mouth and see further what is in there. Ask the patient to open her mouth for me. So do you mind opening your mouth for me, ma'am? Yeah. Okay, so she open. So when the mouth is open, what I'm looking at her tongue, I'm going to look for any deviation, any kind of abnormalities, any drooling. I am looking at her dentation, and if you don't mind keeping it open while I explain to my instructor. So I'm looking for any dentation issue, if there is the lineage, the hard palate, and then I'm looking at the mucosa buccal, which you can put on the gloves and palpate it. Let me grab the gloves down here. Medium. You put on the gloves and palpate the buccal mucosa and ask the patient to see if he has any tenderness or any pain. So this is my patient. I'm going to be palpating the buccal mucosa. Do you have any tenderness or any pain? No. No. So, okay. So that is my test for this. And while I am in there, I am looking at the duct and the sublingual duct underneath her tongue. I'm looking at that redness and looking at the uval, and looking at it, I already asked the patient to do I want to see the tonsil, I want to see the size, I want to see if there's any swollen in that tonsil, which there is none in this patient. So she is good. And so that's complete my test for the mouth. And the final test that I have that I'm going to be doing today is the neck test. So while I am on her neck, I will be inspecting the neck for symmetry. I'm inspecting the trachea, excuse me, to see how symmetry, if it's midline, which it is. If you palpate it, and you can see it's midline here. But before I go into palpating on her lymph, I want to check her range of motion. Can you hyperflex for me? Can you bring it down for me? Can you go lateral to the other side and this other side? Can you shrug your shoulder for me? So I am testing her range of motion, how she can move the neck, if she can move the neck every of this direction. Then let me go further to palpating her, looking for lymph nodes in this patient. So what I am going to do at this point is I want to start my palpation by going into the preocular, which is here in the front of the ear. I'm palpating for any lymph node, which there is nothing I can see here. And then I go here, and I'm the back of the ear. I have the posterior ocular, and there is nothing. I come here. This is her tonsillar. I'm going into her tonsillar. Then I have the occipital at the back here. This is the occipital of this patient. Then I am going to go to the mandibular, submandibular, which is right here. This is her submandibular. I come in to palpate at the submental. This is her submental. Then I will go down to the anterior cervical. Then I go to the posterior cervical. And the next one is called the deep cervical. In the deep cervical, I would like her to turn her neck like this, and this is around here. That is where I do my deep cervical. And can you turn to the other side too? This is my deep cervical when she turned her neck to the other side. Then I have another one, which is the clavicle. And then I have the anterior clavicle, and then I have the posterior clavicle, and then I have the interclavicle. So the interclavicle is just between the posterior and the anterior clavicle. So this brings me, and there is no node that I see in this patient. But if there is anything that I see, like the nodes, the node has to be movable. It has to be non-tender. But if it's tender and unmovable, that is like hard, it's a cause for concern, and we may need a further test examination to clarify that. And this brings me to the end of this examination, and thank you for letting me do it on you. You're welcome.